My name is Breda Gahan. I'm the Global Health and HIV Team Lead with Concern, who I've been working with for the last 28 years. I was 10 when I started, so that's my current age.
She sounds very young.
Very young.
Breda tells lies.
And I do notice the gender imbalance in the room, but everybody is very welcome. And that gentleman who just arrived, you're welcome to come up closer. Don't feel cold down there at the back all by yourself. Thank you. I just sort of thought of it because I only got back from London late on Wednesday night, so yesterday I quickly put some photographs on slides and thought, what are my sort of top 10 highlights? And some of them are what Deirdre has said. This is the busiest slide, and I'm not going to read everything that's on it. But Durban was the 5th AIDS conference I've been to. I was in Barcelona in 2002. Bangkok in 2004 with our concerned colleagues and partners, Toronto in 2006, then I delegated in 2008, I was in 2010 in Vienna, and I hadn't been for 6 years until I was back to South Africa. I wasn't at the year 2000 Durban conference, but I was kind of looking at the comparison to see what had changed in 16 years. And basically on the left side, the key players that year were Nelson Mandela and Nkosi Johnston, both sadly deceased now. And at the time, Nelson Mandela was challenging his own government, including Mr. Mbeki, regarding the tragedy of unprecedented proportions that is unfolding. At that time, there were 2.8 million deaths in 1999. The emphasis in 1999 was still on care and support. Only Brazil, in the low developing countries, was providing universal access to antiretroviral medications. If anybody wants to take the slides later, you're welcome, so don't feel you have to write down anything. And Nkosi Johnston spoke, and I've often looked at his video from that conference 16 years ago. He'd be 27 now, I guess, if he was alive and had had the right to treatment then. He was an 11-year-old small boy that really shook the foundations of the inequality in terms of people's lack of access to prevention, treatment, care and support. Quote from him, "Care for us and accept us, we are all human beings." People were very despondent following that Durban conference in year 2000, given the government's position, their lack of recognition of the impact it was having socially and emotionally on the continent of South Africa, when the rest of the world was in euphoria because of liberation and Mandela being released and a new democracy. But really for people living with and affected by HIV, it was a terrible time. Fast forward to 2016, 16 years later, and as Deirdre said, there were lots of mentions. Even I find it hard to believe, and like myself, many of you here are probably not much more than, or definitely under 35 years old, but since the start of the epidemic in the early 80s, 78 million people have been infected and 35 million people have died. That is a genocide. I'm sorry, that is a genocide. Currently, 36.7 million people are living with HIV at the end of 2015, but approximately half of people living with HIV have never been tested and don't know their status, for many of the reasons you've been talking about, Deirdre. The good news is that, compared to zero in Africa on antiretrovirals in year 2000, globally now, and the burden is still in sub-Saharan Africa, and Irish Aid and our partners down there well acknowledge the impact it's having on the development capacity in those countries, including Zimbabwe, Mozambique, Lesotho, South Africa. Globally, 17 million people are now on ARVs. That's good news. 17 million people. I did see Prince Harry, didn't go to shake his hand, but he said we now face a new risk, and it's probably in my last slide as well, the risk of complacency. Oh, it's been there forever. Charlize Theron, again, spoke very powerfully about the impact on women, the economic issues of women in South Africa, as a white South African woman, again, who spoke about her privilege. She's not living with HIV, but she knows people who have died, colleagues. It's time to face the truth about the unjust world we live in. The truth is that we have every tool we need to prevent the spread of HIV. let's ask ourselves why in Durban, why here in this room. Let's ask why haven't we beaten this epidemic? I think it's still a good question. She spoke brilliantly at the conference. And just to bring us up to date in Ireland, I looked on the Centre for Disease Prevalence in Ireland yesterday, the 28th of September. What's the number of diagnoses in Ireland for 2016? What number do you see there? 2016? 390. So more than one a day diagnosed in Ireland this year so far. Up 56 on the diagnosis last year. Now getting tested and knowing your diagnosis is a good thing. So we have to interpret that data carefully. But still, that's 390 people up until yesterday who started the year not knowing their status, and now they know they're going to be on antiretroviral treatment for life. It's a big change in lifestyles, and based on the criminalization issues, there are some countries they would not be allowed to enter, to study, or to work. That is the reality. So it's not just in Southern Africa. Oh yeah, I put up there at the top, in the data for 2015, people get diagnosed very late in Ireland. There were 491 cases total in 2015, and 29 were defined with AIDS at the time of their diagnosis. Because they were advanced, they were quite sick, probably wondering why, eventually got tested and it's AIDS. Now thankfully with treatment you can reverse the impact of AIDS to be living positively with HIV. But that's still 29 people last year, 2015 just passed. I was at the pre-nursing conference, being a nurse midwife, Mater Coombe, James's, the 2 days before the official conference. And apparently it's the first time they've ever had a pre-nursing conference, really to celebrate the nursing response to HIV. And anybody who's been here and worked in St. James's Hospital, where I worked in the early days of the epidemic on the top of one, even struck me. I went, yeah, nurses have never actually really been acknowledged in terms of the work they've done locally and globally in the response. And they took the theme of access, equity, rights in terms of demanding greater investments in nursing. We called for policy changes to support nurse-led care to reach more people. Very few doctors in many of the countries where I've worked, Iraq, Sudan, Cambodia, Mozambique, all post-conflict in the early days, very few doctors. Calling for greater investments in nursing, support for interprofessional collaboration and equity in decision making. And then in terms of access, improving access to healthcare by removing the political, legal and economic barriers to nurse-led care. In some countries, maybe even in Ireland, the medical profession will not allow nurses to have greater autonomy in terms of service provision. They hold back delivery of frontline services. Equity in terms of building sustainable solutions, increasing representation of nurses on policy guidelines and other decision-making bodies, and in terms of rights, demanding an end to HIV stigma, discrimination, and unjust HIV criminalization. You know, we're not just nurses, we're not just midwives, we're activists, and we want to be part of the global response. And I have now joined the Association of Nurses in AIDS Care to support the global responses of nurses locally and globally, moving forward to get treatment to the 19 million people who are still not on treatment, who've never been tested, have never been diagnosed. So it was very invigorating to be there, and there's a whole website. You know, anybody else? Any other nurses in the room? Great. Oh yes, how could I forget? You know, you can look up on the website and see all the slides that were presented at the 2-day meeting on the Friday. It was on the Saturday and Sunday before the official conference. Okay, another highlight for me, and again there's a lot on this slide, but I don't need to read all of it. But really, it was, I'd written to Ambassador Liam McGowan before I went, saying I was going to go to South Africa. Was Irish Aid planning anything for Pretoria? Tamara, his great person, got back and said, yes, please meet when you arrive. I contacted Deirdre, we said where? We joined their entire events on Monday. It was Mandela Day, yes, the 18th of July. And he spoke at a satellite session, Left Behind But Not Forgotten, the important role of civil society that some people in certain African countries are trying to silence now in terms of the HIV response and in development generally. We know the new laws that are appearing in India, Ethiopia, Rwanda, Burundi. And one of his quotes was, Vincent has his full speech. I have a copy of it, but I didn't bring my laptop today if anybody wants me to share it with them. Our focus today is to draw attention to those that are already being left behind and who remain under-prioritized in the global HIV and AIDS response. We are here together to highlight the voice and agency of civil society. Even based on the Akiba conference some of us were at this morning, civil society is still important. It has a voice to galvanize and amplify the response. Leaving no one behind, as you were saying, Deirdre, means removing punitive laws, policies and practices that violate people's dignity and human rights. It means that everyone affected must have access to comprehensive HIV services without discrimination. His speech was very effective, very, very important. I was proud that our ambassador was able to speak in the HIV Museum where this event was hosted, with Edmund Cameron, Constitutional Court of South Africa, who thankfully did say he's living positively with HIV. He spoke about white privilege. Prevention remains a key necessity in all our strategies about AIDS. Prevention, prevention, prevention. Second, we have to, this is verbatim from his speech. Anybody wants them? I have them all saved in my laptop. We have to test, 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 test. Testing is the gateway to everything in terms of treatment. Psychosocial support, counselling, all other services. We have not tamed the social and political determinants of HIV, particularly the overlapping inequalities on which HIV and AIDS thrives. These include gender, education, access to healthcare, access to justice. It was a wonderful day, and we sent them a thank you email. It was really a great day, and I was very proud to be with the Irish ambassador and to see the warm welcome we got in quite a small space, about the size of this room, with mostly all African members. I think we were the only other two white and Irish people there. This is the Museum of HIV Memory and Learning. Why a HIV Museum? It's a special project they've got funding for from July 2016 to 2017. If anybody goes to Durban, great place to have a holiday, great food, great wine, very cheap. I had a wonderful Airbnb there I could recommend. Go and visit this museum. It was not morbid. I was thinking, why would you want to have an HIV museum? Well, this is why. Having AIDS 2016 back on South African shores provides the perfect momentum for the creation of the museum. It creates a space to pay tribute to those who have suffered, as well as celebrate those who continue to live with HIV. Learning opportunity for a new generation. A reminder that there is still much to do if we're to reach the 1990 targets set by UNAIDS for 2030. I'll come back to them. But that beautiful museum and that beautiful building, that's a small picture there, is on Bram Fisher Road in Durban. If anybody goes to South Africa, please visit. Say we sent you. The second event I went to, again, was a side event in the evening, and it was about community health workers. It was a documentary film and a discussion on the evening of the 21st of July. And I picked up the leaflet and I went, oh gosh, I think I'll have to go along to that. Where is it? How did I get myself there? Anyway, some South African women guided us all down the street singing and dancing, and 20 minutes later we got to the venue. It was a wonderful event. And their strategy, or their comment, is that a world without community health workers means certain death for many patients who have little access to quality health care. And I'm sure that's, especially for our new master's students here, that is a real reality for people in poor countries, in many countries in which we're working. In Iraq, in rural areas where I went to see, even though I was working in Baghdad, 2 years there, in Sudan certainly, most people never went to a health facility. They'd never seen a building, they'd never seen a qualified nurse or a qualified midwife. All they knew were community health workers. So if we don't impart community health workers, and it's not fashionable to say so, we will not get healthcare expanded to the populations who need it. They're a lifeline for many vulnerable people, yet they face hardship, threatening conditions, and insufficient and irregular pay. I couldn't believe this, but in South Africa, in June 2014, health workers were arrested in protest of the dismissal of, tech activists supported and had a protest in terms of the dismissal of community health workers in the state of the healthcare system. The new idea from the World Health Organization is we don't need community health workers anymore. Let's have qualified nurses, qualified midwives. Well, we can't pay the amount of nurses and midwives we need in a first world country like Ireland post the recent recession. So they had a protest. They were arrested and charged with violating the Regulation of Gatherings Act of 1993, almost criminalising community health workers. Years of debate, the penalties were later suspended on condition of non-reoffending. And following the showing of the film, I would suggest you download it and have a look at it, particularly people here for the master's class. We had discussions there with the Minister for Health, the Director General, the World Health Organization representative, who was sympathetic somehow, MSF, and then TAC Treatment Action Campaign, probably some of the greatest activists in South Africa, and Section 27, an NGO representing community health workers. The next slide, and Deirdre and I saw this, reminded me why I had to go to that meeting. Because when I saw this picture, and even I know that this is the annual meeting, not for Hello Magazine. But when I walked past that graveyard in the global village, I thought of Ebola, where Concern has been responding to HIV, to Ebola and HIV in Sierra Leone and Liberia, with the support of Irish Aid in both countries. I just don't know, when I saw the mock gravestones, I thought of Ebola. But basically, the banner on the side said, discarded and disregarded, community health workers in South Africa. Give community health workers recognition. And they were speaking there every day, dancing, singing, but they couldn't afford to get to the official conference. They were in the global village, outside the gate, where we were passing through every day with our security. Jack, welcome. We had to get our security pass to go from the global village into... We had to go to with our security pass to get to the main conference hall. There was heavy security in South Africa to enter the official hall. But it wasn't heavy. People were extremely friendly everywhere. They started recognizing us. Bags were checked. But these community health workers couldn't afford to get into the main conference. So they had their protests and all their activism. And I went to their event at a local hotel, the African hotel down the road, to support the argument that community health workers need to be given a right and to be recognised. Otherwise, we will not reach universal access to healthcare in Africa and Asian countries where we, in Concern, and all of us here in Trócaire, work with the extreme poor. That is the reality. So I would ask you to support that campaign. I can't say too much more about it now, because my fourth highlight was about stopping HIV discrimination, and imprisonment. A lot of the rest are photographs really, and sex workers. And again, the HIV discrimination tree, I'm sure you signed your little card, Deirdre. You know, this was supporting migrants, marginalised, minority, prison, mobile populations, especially now with the migrant issue, men who have sex with men, all the acronyms, most at-risk populations, intravenous drug users, formal and informal sex workers, and the lesbian, gay, bisexual, transgender, intersex population who remain in the shadows. And speaker after speaker, both in the global village and at the main conference venue, spoke about the punitive laws that can inhibit their access to services. So stigma and discrimination and personalised, internalised stigma remains a big issue. And this was so real. This was at the exhibition booth. There was what looked like a policeman chasing this woman with a baton, and I was like, why is nobody responding? Even I shouted, I said, what do you think you're doing? And then I realised it was a drama, of course. He was beating her over the head because she was the sex worker, but I thought it was real. I went, does he think she's stolen something or something? It was so real. It's like one of these, when they have a flash dance or flash mob. I really didn't know that. I went, this is powerful. We need to be more, innovative in our work in terms of education, and reaching out to young people and speaking about the rights and do it in a fun way. You know, it was amazing. And they just kept having their breakout flash mobs. The fifth highlight of my week in Durban was I took an opportunity to go to one afternoon to visit a local organisation working in Durban called the Hillcrest AIDS Centre. And they were founded in 1990 to provide love and hope to HIV and AIDS impacted communities in the Valley of 1,000 Hills in KwaZulu-Natal. They respond to HIV and AIDS from 4 primary angles: prevention, care, community outreach, and income generation. Their website is here. They do wonderful work. A lot of us, this badge was made there with the Irish flag on it. It's income generation. I met the granny groups, they're called Go-Go's, again doing wonderful work because a lot of the grannies are not taking care of the orphans when the adult children died before they had access to treatment in South Africa. A wonderful local organisation doing great work. Again, if you're in Durban, go to see them and see what they're doing. I was really fascinated. And their care and love and understanding, and you could see the empathy. They have a 24-bed respite unit. We didn't go into it. Some people came out, and you could just see the empathy and support. And workers there, they're surviving on donations and support. And the empathy and support, you could just feel the energy in the place. So the role of CBOs and local NGOs continues to be critically important in the response. I don't need to say too much more about 6A and 6B because Deirdre has spoken about it, but the gender inequality of HIV. Every hour still, 50 young women are newly infected with HIV. Due to gender inequality, gender-based violence, and as we were at the Akidwa conference this morning, unhygienic, even if it's ever right, female genital mutilation in African countries where I've lived and worked, that it's still practiced. For me, Sudan, every single woman I saw deliver was pharaonically circumcised. And can you imagine if dirty instruments are being used and shared in a country where there's higher prevalence, like in West Africa, like Sierra Leone or Liberia? Salim Karim said reducing new HIV infections in young women is one of the greatest challenges in Africa and Asia, I would say. And I learned a new word that I'd never heard of in South Africa. Any of the master's students here from South Africa? Great. Have you heard of this word called the blessers?
No, I grew up in Canada.
Oh.
Yeah, I've been living there for the last few years and it's become a big thing in the last year or so.
You've heard that word in the blessers?
It's a big trend.
I was shocked. I had never heard this word. I was like, what is this? Apparently blessers are rich men who bribe schoolgirls for sex with phones and cheap shoes, are a main driver of the highest HIV rates in the world. And at the end of the conference, thankfully, Michelle Sidibe, the head of UNAIDS, said, to the blessers, there is only one level I want, 0 level. 0 tolerance for men who put adolescent girls at risk. Oh, and I've heard different words used in other countries where I've worked. The 3C factor in Malawi, I think it's called. Young girls get into relationships with older men for access to car, cell phone and cash. Because poor families can't afford to give them the basics that they as trendy young teenagers getting to secondary school want to have. Particularly happens in secondary school. And then my 6B slide is increasingly, I mean I thought this was good from the conference, you know, women are leading the HIV and AIDS response in Africa, especially among community health workers and nurses. Again, Charlize Theron, we have every tool we need to prevent the spread of HIV, every tool we need, and yet 2.1 million people, 150,000 children infected with HIV just last year. The real reason we haven't beaten the epidemic boils down to one simple fact. We value some lives more than others. Olive Shisana, lovely black South African woman, was co-chair for the first time ever of the AIDS conference. We have lost momentum when it comes to social, structural and behaviour HIV prevention. We need to ask ourselves, why is this the case? To address these challenges adequately, we must ask, who is vulnerable? Who is vulnerable and why? And Deirdre again spoke a lot about the vulnerability of poor people and young girls and women. And most of the community health workers I met at the side event and at the nursing HIV conference, 80% in the room were women. Expansion of nurse-initiated management of ART. And Dr. Jack, I'm sure, will refer to this. Again, because Concern doesn't actually work in South Africa, Does Trogram? No. NEMART, Nurse-Initiated Management of ART. So nurses are supporting people to come in, do the testing, the counselling, getting them on the path to treatment. Testing is the gateway to treatment. And the new World Health Organization rules are that test and treat. Start treatment immediately somebody is tested, as we're doing in Ireland. Again, obviously the role of community health workers to support self-testing, counselling and referral to the appropriate services. And the best people to educate adolescent girls and young women on HIV prevention are female health workers and nurses who understand some of the issues we heard about at the Akidwa conference this morning, in terms of lack of economic capacity to support their own hygiene issues, and that in a country where there's lack of latrines, safe toilets, all of that going to school. This was a very nice event I went to, so I put it number 7. Anybody know Johnny Clegg? I bought his album. I had heard of him, but I'd never listened to his music. He was brilliant. His album is super. Go out and get it. Anybody else can tell you the exact name. But it was a fundraising concert for TAC, the best advocacy organisation in the world I've ever met. Treatment Action Campaign, TAC. So not the other celebs, but for me he was the most important. Even though I did see Elton John, Bishop Desmond Tutu was very unwell. He spoke by video conference, but again powerfully. And Prince Harry, again for African TV, had a live HIV test. So that was my 7th highlight. Number 8, a bit of a downer, the low progress on HIV prevention. The extreme poor need to be included within and beyond the 12 key populations, as they are being left behind. Age-related deaths still the number 1 cause of adolescence in Africa. Decline in new cases among adults, including in Ireland, has stalled. And I just saw this last night when I looked at the Lancet, 74 countries saw increases in rates of new HIV infections between 2005 and 2015. And the greatest increases were in the low HIV prevalence countries. So the global burden in terms of sheer numbers is increasing. We can't treat ourselves out of the epidemic. Meanwhile, the 2020 targets, we've only 4 years left. Get 90% of people living with HIV diagnosed, 90% of those on treatment, and 90% of those virally suppressed, so that they're not infectious in terms of passing on the virus. The treatment gap, I said it earlier, 17 million people are currently on treatment, but the biggest majority are not on treatment. 19.7 million people still unreached. And you see the gap between children and adults. Who's going to bridge that gap? You know, us here in the room and beyond that, community health workers, nurses, scientists, doctors. Huge treatment access gap. I'm not going to say any more. Just close the gap and leave no one behind. Everybody talks about the 12 population groups. Some of us are members of many of them. You could be a young woman, a pregnant woman, a child, a transgender woman, a displaced person, a person with a disability, a migrant. But for me, and working with Concern, extremely poor people living with and affected by HIV could be part of any of these 12 groups. But they are so important, and to me they need to be additionally 12 plus 1, the extreme poor in Southern Africa and in Asia where we're working. This is the Durban Declaration. I'm not going to read it. But basically it's focusing on 5 key scientific advances, which I'm sure Dr. Jack will mention, and addressing the 5 key structural barriers to HIV. When you get the slides, if you hit that link, you'll get the entire statement. But it's a call to action going forward. This is my last slide. The political declaration on HIV and AIDS was re-agreed in June 2016 by the United Nations General Assembly in New York. Vincent was there. He can update us on the findings. And again, reiterated in Durban with our Ambassador Liam McGowan and others who constantly refer to the political commitments. But political commitments are useless without leadership and resources. We need to resource response. My worry now is about the risk of complacency until we get to 0 by 2030. 0 infection, 0 discrimination, 0 AIDS-related deaths. And I would hope we can do better by 2020. So thanks for your attention, and any questions?